came to Dr. Reimel's office initially because my husband was complaining of my snoring.
A lot of people think snoring is normal or that it happens as they age. Snoring is not normal. In fact, it's not good for your health. Well, snoring is a blockage of the airway, either in the mouth or the nose. Grinding your teeth is opening up your airway so that you can get air in. So we need to stop the grinding because it's going to wear on the teeth and cause excessive loss of tooth structure. And we need to open up your airway so you can breathe normally throughout the night. Night guards often help with the grinding. It'll protect the tooth structure, but it will not affect or help your sleep apnea. And in fact, it may make it worse. Sleep apnea is where the tongue falls back and closes the airway. So sleep apnea is not diagnosed by a dentist, not diagnosed by me. You come in, we do a consult, and have a good idea of what's actually occurring with you. I refer you to a sleep lab, and at that point, either a neurologist or a sleep specialist will diagnose you with sleep apnea. And from there, we can determine what the best treatment is for you.
My first appointment was eye-opening. I learned a lot about the devices that he recommends, but I also learned about some of the risks involved with having chronic snoring, so I was definitely interested in learning more.
So the easiest way to start getting into the diagnosis of sleep apnea is to come in and get a consult. During that consult, we ask you 8 basic questions, and if you answer yes to a certain number of questions, the possibility, the percentage chance that you have it goes up dramatically. So the 8 questions we typically ask are: do you snore? Are you tired throughout the day? Do you have some form of hypertension? Are you on pressive medications? What's your BMI? Are you overweight? Are you male? Males have a higher preponderance of the disease, right? So we really delve into these questions and try to figure out what your condition is, where you're at in the spectrum. Are you just hypoventilation? Do you have upper airway resistance syndrome? Do you have actually obstructive sleep apnea? Or do you have central sleep apnea? And so it really runs the gamut. So we really have to delve in, partner with a sleep specialist and try to figure out what the issue is. At Carolina's Dental Sleep Centers, we do things a little differently. For my upper airway resistance syndrome patients, for my mild to moderate sleep apneic patients, we go with the dental device. It works 80 to 85% of the time. For my patients that have severe apnea, we send them and refer them to a neurologist or a sleep specialist. So this is the dental device. It's actually pretty small comparatively. With the dental device, it's a small acrylic piece that goes on the upper and lower teeth. And every patient I've ever had says they can't sleep without it. What we do is we put these 2 pieces in, and this brings the bottom jaw forward. The tongue is attached to the bottom jaw, opening up the airway.
When I came in, I was not eligible for a CPAP. My condition was not that severe, but it was severe enough that I was not getting deep, restful sleep. And I had just chalked that up to being a mom. I've got 2 young children and just thought the chronic tiredness was a symptom of being a mom. But I realized now that I get such amazing rest. I'm waking up before my alarm goes off. I have sustained energy throughout the day.
A lot of people want to know where to begin. My recommendation is to go to our website, fill out our online questionnaire. There are 8 questions. If you answer 4 positive, then there's an 85% chance you have sleep apnea. Call our office for a free consult. We'll take care of you from there.
For anyone that has any sort of snoring problem, I would just say come in and get a consult. It's free to get the consult, and the sleep test is really simple. You do it at home, so it's pretty quick and painless, and at least then you know, and then you can evaluate your options. So you have nothing to lose. Just go and check it out.